Hi, here we are with Yvette. We're doing the demonstrations of 5 main causes of chronic fatigue and fibromyalgia that you never would have suspected before watching this video. So every single one of my chronic fatigue and fibromyalgia patients tend to have 3 or 4 out of these 5 things imbalance that's causing their chronic fatigue. Again, we have Yvette here helping out with this demonstration. So first, if the person with the chronic fatigue or fibromyalgia is imbalanced, we need to check to see if their body's telling the truth, and we have a special way to communicate with their body. This has never been done before. Okay, so we're gonna communicate. When I say this has never been done before, this approach is completely unique. So the first thing we need to do is get their body telling the truth. So we have a special way to do that with the use of standard process nutrients. One of them is called Cataplex B12. So Yvette doesn't need any Cataplex B12 to have her body tell the truth. The other one's called ribonucleic acid. She doesn't need any ribonucleic acid to get her body to tell the truth. So her muscle's strong now, and there's ways we could weaken it. Just to make sure she's being honest, say, Yvette, please say, my name is Gerald.
My name is Gerald.
Okay, so Yvette's name is not Gerald, so her arm gets weak. And then say, my name is Yvette.
My name is Yvette.
So because her name is Yvette, she's congruent with that statement, so her arm stays strong. This is a complete science called the art and science of professional applied kinesiology and muscle testing. Okay, and she doesn't need any parotid. So if she were to need one of these truth serum nutrients, parotid, B12, or ribonucleic acid, we would put the nutrient under her tongue. Now we're going to check to see if she's having troubles with something called the ileocecal valve. So I take a fist, I put it here where her ileocecal valve is, and we check to see if she's having trouble with her ileocecal valve. So because the muscle stays strong, she's not having any trouble. If the muscle were to go weak, that would show the circuit here is off. Like the circuit at a house, when you plug in the lamp or you plug in an electrical device, if it doesn't go on, but electricity is coming to the house and the person's paying their electric bill, then there's probably something wrong with the circuitry, right? So that would mean the circuit would be out. So her ileocecal valve circuit works properly. Why is that important with chronic fatigue and fibromyalgia? Because if you can't digest and absorb the nutrients in your food, you're going to have troubles with your energy, and you're going to have troubles with pains and aches and joints, because the amino acids that are broken down into neurotransmitters help decrease pain and inflammation, as do fats and carbohydrates and other nutrients. Actually, fats are just as, if not more important than proteins. Okay, now we're going to check her valves of Houston. She's fine, her circuits work there. Then we're checking something called, I take 3 fingers and I put them here, and that's a quick way to check blood sugar. Breathe normally. And try closing your eyes for a second. Eyes open. And her blood sugar is okay. I can check it eyes open, eyes closed, forebrain and hindbrain. Okay, that was fun. Let's have you, we'll check rib torque. Sorry if that hurts a little bit. Okay, she doesn't have a torque rib. A lot of people have a torque rib. And then we'll have you put 3 fingers on your tongue with that hand. Just 3 fingers go on your tongue. On your tongue? On lingua? Okay. And that's checking for hydration. You can take them off. If you need a tissue, that's fine. You can grab a tissue.
Thanks.
Okay. It's not always as easy when you're doing a video. Okay, so go ahead and lie on your back. Now we can check some muscles that are related to water as well. These are the psoas muscles. I don't know if you can see it on the video, you might be able to, but her psoas muscles are turning in evenly. If they were uneven, we'd want to find out what's causing the imbalance in her body. Again, not enough water would be important, because they say that you could have your energy reduced by up to 40 or 50% or more if you're dehydrated, which is It makes sense. Okay, go ahead and push straight up into my hand, real hard, breathing. Okay, try it again. Okay, that muscle seems to be working all right. And then push up here. Actually, this one's not working quite right. Muscle testing is an art and a science. And push up here, breathing. And this one's not working quite right. So we don't know why they're not working quite right, but we can attempt to find out why. Since the muscle that I'm checking is related to the kidneys, see, every muscle in the body is related to a different bone and joint and ligament, and every muscle, bone, and joint and ligament is related to a different emotion and a different gland and a different homeopathic remedy and a different nutritional supplement and even a different color and even a different sound. There's 7 notes of the scale, just like there are 7 main classical traditional Chinese medicine acupuncture meridians. So anyway, this one's related to the kidneys. So we're just going to see, since water is the main nutrient of the kidneys, just making sure I'm in frame, since water is the main nutrient of the kidneys, let's see if water helps with those muscles. It might help and it might not help. So go ahead and drink a little water, Yvette, and then leave some water in your mouth after you drink some. Okay, good. And then lie back down on your back and don't swallow the water that's in your mouth. Okay, hands by your sides. Okay. So the first time we checked hydration, nothing happened, but this is a fail-proof system. So we don't want any mistakes when it comes to people's health, because what could be more important than your health? Go ahead and push up here, breathing. Okay, try it again. Okay, good. That muscle seems to be working now. And push up here, breathing. And this muscle's working. So yeah, actually, she is a bit dehydrated, and that would be a major cause of something like chronic fatigue syndrome and fibromyalgia, or specifically we're talking about chronic fatigue and fibromyalgia. Okay, you can go ahead and swallow the water. Okay, so I hope this has been helpful. Again, we're going to have some ways that you and I and the other people here on the team can get in touch, and we can help support you through what you're dealing with. So there should be a place where you can enter some information like your email address and your name, and we can get in touch. And we're looking forward to helping you out and working together as a team. Thank you so much. My name is Dr. Ilya Skolnikov. I was excited to bring you this information that's so rare and hard to find about a completely new radical way to treat fibromyalgia and chronic fatigue. Thank you.